Now, we've heard about all these novel therapies that are available with astounding success. Obviously, you're not working in isolation, you're working as a multidisciplinary team. How do you work with physical therapists to optimize the improvement that you can see in building muscle strength with exercise, lifestyle? What advice do you give to patients to maximize their performance outcome from this boosted muscle function?
So Sebastian can tell you we have incredibly rigorous clinical days. So when he comes for an appointment, how long do you think you're there? 2 hours.
You know, I like to stay and talk.
No, that's true. That's true. He's chatty. So probably minimum 2 hours appointments. And that's because of this multidisciplinary team that you've referred to. Physical medicine and rehabilitation specialist is present, a physical therapist, occupational therapist, respiratory therapist. We're monitoring spirometry measurements. We have an SMA dietitian in clinic because nutrition is so incredibly important. We have a social worker, an educational liaison who helps us communicate the needs of our patients to schools. We have a variety of different individuals, including my nurse coordinators, who help to try to make it so that medical appointments do not become your life, that we can try and consolidate to the best that we can. And so it really is an incredible team approach to be able to maintain and optimize the lives of our patients.
You've talked about nutrition. Can you elaborate a little bit on the role of nutrition, diet, lifestyle in the management of this disease? Because we're talking about muscle function. So what kind of advice do you give patients in terms of nutrition? And why is nutrition such a big problem for patients with this disease?
So right now there is not a clinically or scientifically tested diet that is technically recommended. There's still more research that needs to be done into that. But nutrition is incredibly important for patients with SMA. We find that in our younger children, they may be at risk of what's called failure to thrive, where they cannot gain appropriate weight. And that's probably because they're working so hard to keep up with others that their metabolism is just incredibly hard and incredibly high within their muscles. We see that the opposite may happen actually in our adult patients, where it may be difficult for them to lose weight, especially if they have limited mobility. For my patients that cannot walk and that are utilizing wheelchairs and power wheelchairs, their ability to burn calories is so very different, and so they may be at risk of being overweight. So my nutritionist really has to kind of span that entire gap and be able to help to supplement the needs of our kids with failure to thrive, and then be able to help try to modify some of the diets of our older patients who may be at risk of being overweight.
Sebastian, do you feel kind of isolated, having had a diagnosis that's quite a rare diagnosis that most people have never heard of? Does that make you feel nervous when you talk to other doctors who may go, oh, I don't even know what that is, or I've not heard of it?
In the beginning it did, because I honestly didn't know anybody else that had it, but through Dr. Proud and Laura, they're able to put these groups together where you're able to meet people, even of your age, that have the same diagnosis. You're able to form bonds and relationships and actually talk about things that you might not have been able to talk about before. And when you go see these doctors now, you're able not only to be more educated because of what Dr. Proud has told me, but having those conversations, becoming more comfortable having conversations about it.
Right. And now with access to the internet and social media, are you a member of any SMA groups, or are there any particular websites or resources that you think are helpful for parents and families that may be starting off on this journey, looking into treatment options for spinal muscular atrophy?
Yes, I know you can look SMA up, as well as go to the website. This is Centera website, correct?
CureSMA.org?
Yeah, and there's a CureSMA.org website as well. And it gives you a bunch of information up there. And even when you come and see Dr. Proud for the first time, she gives you like a pamphlet and a packet and a book bag. You don't get a book bag, but she gives you a lot of information as well. And there's actually a kit too that comes with everything that breaks it down. Like she said, her pictures that she draws, they'll break it down into pictures, as well as it just gives you a bunch of information to take in and be able to understand and communicate, okay, so from now I know what steps we need to take.
So the largest resource actually comes in the form of Cure SMA. So that is the organization that supports patients and families impacted by spinal muscular atrophy. And there's an annual conference both for patients, families, caregivers, and clinicians every year. There is a website dedicated to this organization, curesma.org. It has resources for families, it has resources for diagnosis, it has identified areas where treatment is being offered, and it will actually keep people updated on some of the newer treatments that may be coming available in the future and research opportunities. So it's a great resource for anyone.